Thank you, Chairman Wu, Ranking Member Smith, and Subcommittee members. My name is Joyce Sensmeier, and I serve as Vice President of Informatics at HIMSS, where I oversee the clinical informatics standards, interoperability, privacy, and security initiatives for the Society. It is a pleasure to be with you today before this subcommittee and alongside these distinguished panelists. I present these comments on behalf of HIMSS, a cause-based, not-for-profit organization exclusively focused on providing global leadership for the optimal use of information technology and management systems for the betterment of healthcare. HIMSS represents more than 30,000 individual members, of which two-thirds work in healthcare provider, governmental, and not-for-profit organizations. HIMSS also includes over 470 corporate members and more than 85 not-for-profit and provider organizations that share our mission. Supporting the adoption and meaningful use of health IT is a key focus for HIMSS membership, and as a nurse and a clinician with several decades of experience, I am deeply committed to improving patient safety and outcomes. It is in that vein that we have addressed the two questions posed by the subcommittee. The first question is related to the progress ONC has made since passage of the HITECH Act. Prior to passage of HITECH and for many decades, standards development organizations used open, consensus-based, volunteer-driven processes working in silos developing health IT standards. With the passage of the HITECH Act, a new process for oversight of health IT standards has been implemented. While forward progress is being made, we would like to identify three specific areas of concern. First, data transport and basic security are focus areas where selected standards are missing, yet necessary for achieving interoperability. For example, until the recommended transport standards are identified, EHR vendors will be forced to support all available transport methods or risk developing software that may not meet future interoperability needs. This lack of guidance in the first stage of meaningful use and the standards criteria creates marketplace confusion and wastes existing resources, ultimately delaying progress. Second, we would like to express concern regarding the selection of multiple standards for the same criterion, such as the selection of two clinical summary standards, CCR and CCD. When two standards are selected, vendors and providers must choose to either support one or instead support both, which is costly, resource-intensive, and minimizes health information exchange across organizations. It is our recommendation that only one standard be selected for each criterion in future stages of meaningful use. Our third area of concern is the timing of identifying and selecting the standards and subsequent rules. Timing is critical to ensure the industry can appropriately incorporate these standards into the product development and implementation cycle. Thousands of EHR systems are currently being developed and upgraded by vendors and implemented by healthcare providers. To ensure optimal software development, testing, and safe implementation, the final rules for meaningful use and standards should be available 18 months before the next stage. The second question relates to the strengths and weaknesses of the current health IT standards identification and development process. HIMSS was pleased that the final rule established standards criteria for supporting stage one of meaningful use, and specifically that structured lab test results and appropriate implementation guidance were added. HIMSS urges CMS, ONC, and NIST to ensure that all contractual engagements in the standards harmonization are coordinated and leverage the public domain work products of standards harmonization bodies such as HITSB and Integrating the Healthcare Enterprise, IHE. We also request that they complement rather than duplicate each agency's efforts when creating testing procedures, tools, services, and reference implementations, and that they embrace a transparent and open consensus process with the private sector. We also recommend that HHS publish implementation guidance for all selected standards, publish standards for data transport, financial transactions, security, and health information exchange as soon as possible, publish the process and schedule for harmonizing standards, and set up one repository, such as the National Library of Medicine, for licensure and access to all standards and implementation guides. HIMSS is pleased to see these final rules being implemented in order to put into action the legislative and executive branch intent to transform healthcare using IT. I thank you for this opportunity, and I'd be happy to answer questions, and we look forward to providing our members expertise to help transform healthcare in the United States.
Thank you.